Welcome to the HR Empowerment Podcast, where we will uncover strategies and new insights from HR professionals who discuss up-to-date regulations, best practices, and the most pressing topics like diversity and equity, leadership, dealing with difficult situations, and much more that affect your bottom line and business. Thanks for joining us.
Hey everybody, Wendy Sellers here, the HR lady. Thanks for coming today. Today we have an awesome guest here. We're going to talk about how personalized health benefits shape workplace culture. What? We are here today discussing this with Stacy Edgar, CEO and co-founder at Venture, an AI and digital health startup that works with employers to introduce consumer-centric model of health insurance. Oh my God, I'm so excited about this. Thanks for coming today, Stacy. Tell our listeners about yourself and how you got to where you are now.
Yeah, well, thanks so much for having me, Wendy, and excited to tell you all a little bit about what we do and also to kick off the new year. I know health and benefits, our health especially, is often a New Year's resolution for many folks. And so what we do is we work with employers to take advantage of a new model of health insurance where instead of doing, your one size fits all group plan, you give the employee cash. That cash is pre-tax for both the business and for the employee.
Oh,
But you get to decide, what's the right mix of, you have to buy insurance still. So it's not just we're replacing insurance, but you might buy that familiar Blue Cross Blue Shield or Kaiser plan, but you don't have to spend all your money on insurance. And you get to basically decide what's the right mix of insurance and cash that's right for you. And
wow, this is interesting. I have
yeah,
so many
yeah.
questions.
So hey, if you're somebody who, either through need or through temperament, we all have that person in our lives who wants everything covered, every scenario covered. Maybe it makes sense to spend all the money on insurance. But for a lot of us, most Americans, they go to the doctor a few times a year. They're not meeting their deductible. They're not meeting their out-of-pocket max. And that cash all of a sudden becomes a way to invest in, could be wellness, anything from massage, gym memberships, a new Apple Watch, like to maybe track habits, or like so many different things. It really depends on the person. And that's where the personalization comes in. It's in really deciding how to use this money to keep yourself healthy and well and protected.
I love it. I'm going to jump right in and ask you a question since you just mentioned about personalization. I really want to talk about personalization and flexibility in benefits. You've spoken previously about the need to move beyond one size fits all benefits packages, like you just said. Could you walk us through how personalization and flexibility in health benefits are reshaping employee expectations?
Yes.
And then the follow up there is, how can employers actually meet those expectations without the cost spiraling out of control? And I think you just already started doing that. So share with us about that.
Yeah. Well, there's two broader trends that I think that are important to call out. First is there's personalization in every element of our lives now. And that's because of technology. Like, think about, I get so mad when somebody messes with my Netflix algorithm. I'm like, what is this? Right. So, like, it just like we're trained from different consumer technology that, everything's designed custom fit to us. And the second trend is more of a workplace trend. There's now four generations in the workforce. So you've got your Gen Zers. I bet also we'll see the Gen Alphas soon. I guess maybe they're not old enough, but Gen Z all the way to your boomers. And their lives are so different. Like what you need
Right.
at Gen Z versus, maybe a millennial who's in the family stage or it could be solo. Like it's just so different. And so what this does is allows, instead of saying, okay, everybody's going to get the same package, like for your younger worker, maybe it makes sense to let them invest in cash. And then maybe for your older workers, like, like they need more insurance and like, okay, like great, let them do that. And there's so many stories I could tell you about how this works out within a workforce, but you're basically this model lets us to kind of keep up with technology
Yeah.
and the fact that like regardless of whether an employer wants to do this or not, like their whole workforce is being trained that this is just
Right.
a thing that we get in life.
Yeah. Yeah, I was reading a MetLife survey. It was from 2024, so not too long ago. They found that 79% of workers want benefits tailored to their life stages, their positions, and their personal circumstances. So this, what you're talking about could 100% help achieve that. But I don't think many employers and HR people know about this because we're just usually force fed the group model. So, is this legal across the United States?
Yes, it was put into law in 2020,
Okay.
and it's an executive order right now. Actually was done during the first Trump administration, and it builds on the Affordable Care Act. So,
Okay.
yes, and actually there's laws right now. There's different working groups, and there's laws right now in Congress being considered to expand it.
Excellent. And what do we call this?
It's called an individual coverage health reimbursement arrangement. And uh, hopefully by the time, maybe this podcast comes out, because the laws in Congress right now, they're considering changing the law to choice.
Okay.
So you can think of either ICHRA, as that's the current acronym, or choice, which my hot take, that's a 10x better name for.
Yes, when I was prepping to meet with you, I was like, what is ICHRA? And I'm the HR lady, and I used to,
Yeah.
have my benefits, my agent's license and everything. And this is even, kind of foreign to me too. At least the nitty-gritty of it is. It's so important to understand that, many employees, many candidates, they only go to a company in the beginning because of the benefits, right? And so health benefits is also a retention strategy, right, Stacy?
Yes, 100%.
So
100%.
many employees and employers, view health benefits as a cost center on both sides, but it really is part of the hiring and the employee engagement and the retention strategy. From your experience, how are forward looking companies reframing health benefits, knowing what we have right now, into a strategic driver for retention and workplace culture?
Well, I think, I love the phrase total rewards that I hear a lot of HR and brokers talk about. And I think that's the right mindset, because this really is, like you could think about it as a cost center. And then maybe the temptation, if you start to frame it that way, is, this is a burden. What's the
Right.
minimum we can pay versus who we can attract? So this model, it works for a business, a very small business. There's no, like, a business of one employee only, all the way to businesses in the tens of thousands, like all the way even the Fortune 500. And what it enables you to do is compete, if you're a smaller business, especially with the big benefits companies, the group plans out there. You're just not going to get the same if you're fighting in the old way.
Yeah.
You're not going to get the same offering that like Google has or something like that. But
Yeah.
all of a sudden, if you show up and you give a comparable cash equivalent, then all of a sudden employees are like, whoa, 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 what is this? And then it changes who you're able to attract, and maybe who's able to say yes to your job in the
Right.
first place, because maybe there was something in the behind the scenes with their family that they caused them to decline and have to take a job with a certain type of business. So I think it levels the playing field for a lot of businesses. And then on the culture side, so I'll tell you a story from our company. So the cash you get to keep, we call the health wallet. And when people are getting to know each other, that's totally by accident. People ask, "How are you spending your health wallet?" And then they're starting to say, "Oh, I bought a new bed," and they're like, "What? Really?" It's like, "Well, sleep's important. It's part of your health."
Right.
Or, they're like, "I bought this bike," or, "Oh, I'm going to try out this new thing," like that, and it's really created this incentivized of, I invest in my wellness across the company, and made it this thing we all share. And
Yeah.
that's so powerful.
And then you're all chatting about it over
Yeah.
coffee or over lunch and going, wait, you can do that? That's amazing. Is there a like minimum employee headcount that is necessary for the currently what is known as the individual coverage health reimbursement arrangement? Whew, that's a mouthful.
I know. I know. Yeah. No, there isn't. It's just takes, and that's actually, we also see businesses, like we see a lot of franchises. We work with a number of like Wendy's, and we've got a few Dunkin' Donut franchises where
Hmm.
they may have several hundred people, but only like 20 or 30% on their benefits.
Okay.
So this is really flexible because there's no minimum. And the or small business, say like 10 people and nine of them have spousal coverage and that one person's left behind. Um, you can
Yes.
cover that one person through this. So it's just such a flexible instrument.
That is amazing. In that study that I mentioned earlier, it's the MetLife's 2024 Employee Benefits Trend Study. 70% of employees believe benefits that can be customized to meet their needs would increase their loyalty to their companies. And so this goes right into what we were saying. It's not just an attraction tool, it's a retention tool. And then on top of that, if you do everything else, maybe do some management training and leadership coaching, get your managers where they need to be. Ta-da! Now you have an engagement tool too, and all for the same, hopefully even less money than before. So you can have like fitness memberships, learning stipends, correct?
Learning stipends, no, but fitness memberships, yes, absolutely.
Okay. But I mean, you
Absolutely.
could still have learning stipends outside of this, right?
Outside of
And
this,
just
you're
saying, like,
totally
okay,
right.
personalization as a new standard is you have to think outside the box. And then flexibility, if you're not being flexible with your employees from everything from work-life balance to, hey, I need to peace out for 2 hours to hurry up and run over to check on somebody in the hospital, you're already not doing a good job as a manager or as a company. So this is amazing. Other questions that I have here, diving just deeper into I'll just do the abbreviation ICHRA. Um, you know, what is some of the biggest opportunities, or more importantly, some of the challenges that you might see with this?
Well, the biggest one that people are afraid of is, health insurance can be so scary and
Hmm. Yes,
overwhelming.
it can.
And we hear from people, how can you possibly choose? And the average consumer will see 100 plans available to them.
Wow, that's
I
a
know.
lot.
Yes, but it's a good thing. It's a good thing because think about it this way. That's 100 insurance carrier plans fighting for you. And you know what? Let them fight for your business. They should. Uh, so it really consumerizes the sector. And in the first part, there's two things that are solvable. First, we spend a lot of time all throughout the fall. Our team has been working with employees in partnership with HR to educate and to either do that in group settings or one-on-one settings and just to educate. Hey, this is what a deductible is. This is what your out-of-pocket max is. Here's how you should think about this if you've got this going on, and just really personalize the advice we're giving. And there was a client actually I visited who's on their fifth year of doing this. They were one of the early adopters, and the
Wow.
employees came in and they were like, it was like they were so advanced. They were like, I was doing this research and I just wanted to ask, like, it's I was noticing, how do I find this in the formulary or blah blah blah. Like it was like so specific. And what it showed me was that over and over, people can learn this. And what the research also shows is that, if you have better health insurance and healthcare literacy, you have better health outcomes and better financial outcomes. And
Yeah.
so this is so important to like actually this whole thing of like people can't choose, we have to do it for them. I think we need to support them. But if there's one thing people do this year, I'm really passionate about this. I guess it's a little preachy of me, but you should know about your health insurance because that like healthcare is the leading cause of bankruptcy and it is as big a financial decision as your mortgage and your credit cards and retirement, your 401k. It's up there and we
Yeah.
don't treat it like that. So this is an opportunity like kind of forces you to do it, but once you get over that transition, the workforce is so powerful and you have that for the rest of your life.
Yeah, absolutely. And while you're talking, I had some questions in my head, and then you actually answered them already of saying like people should be educated on terminology. So I have two questions on that in a moment. But first, I wanted to just share this statistic with you because it goes right into what you just said. 44% of employees say choice and flexibility are key when evaluating benefits. However, only 40% feel that they actually chose the best option at enrollment. And I think that's also because there's a guidance gap, right? There's an education gap. And if you're going with traditional healthcare options, you only have one or two choices. And so you're forced to pick one or two of those choices that your employer provides you if you're going through the employer route. Affordable Care Act maybe gives you a little bit more options, but it's not always affordable depending on how much money you make. So, with that said, you use some terminology, and I know this, but I just want to put you on the spot a little bit. What does deductible mean? What does out of pocket mean?
Yeah.
Out of pocket maximum.
Let's start with the out of pocket because I think that's the most important term, and we sometimes we think about price and deductible first, but out of pocket maximums are legal limits of how much you can be charged in a year for covered healthcare costs. So I put it this way, if you I hope nobody here, you or your listeners ever need this, but if you needed $1 million of healthcare in a year, your out-of-pocket maximum, say for having a flat number, it's $5,000, you would pay $5,000 of it. If it's $2,000, you pay 2,000. If it's 10,000, you pay 10,000. It's the legal limit of
Right.
how much financial exposure you have. Your deductible is how much you're going to pay out of pocket before insurance kicks in. So if you got $1,000 deductible, you got to pay the first $1,000. And then after that $1,000, then uh, insurance will cover it per the agreement of your, what your insurance plan. Maybe it's a copay after that, or maybe it's
Yeah,
a,
that was the next terminology to say. Then we have the thing called copay and then sometimes co-insurance, right?
Mhm.
So the copay for our listeners, and I think everybody that's listening who's in HR knows this, but in case you're just dabbling in it, it's more like a fixed set amount you pay for a specific covered healthcare service, usually maybe a doctor's visit after you met that deductible she just explained, correct?
Yeah, yeah,
Yeah.
and then your co-insurance, right? It's a percentage of the total cost. So
Yeah. It's
yeah,
very confusing. And I really think, where we're at in the United States now, especially with so many people getting their own insurance, starting their own businesses, being entrepreneurs, independent contractors, which is a huge rise of independent contractors. They need to know this terminology. I really think we should be teaching this like in school, not
yeah,
just college, but high school. Like, here's the basics of how to balance your bank account. And then, by the way, here's some common health insurance terms that you're probably going to know. So, for anybody out there listening, please launch this service.
yes, absolutely. And for any company that wants to, we will partner with you and help you to do that. It's so important, and we believe like I said, like informed consumer is a powerful consumer, and it's a healthier and wealthier one. And thinking about a company, right? Like you want that for your employees.
Right, right.
Yeah.
And it's unfortunate that it is put on employers to explain this when, our country should be leading this. But that's a
Yeah.
whole other conversation for another day.
You know what this also does for HR and also for business owners? Okay, so we have a group plan for our dental and vision insurance, and I did a poll of like, what do you like about it? What do you don't like about it? And 50% of the company said they love it. 50% of the company said they hated it. And I was like, okay,
Hmm,
what do you not like about it? And but we then, got a new plan, and I think we're still probably 50-50. And so like one of the thankless parts about employee benefits is you're like, oh, I'm gonna make somebody unhappy no matter what I do. In
yeah,
this case, you're basically saying to the employees, you do you. And
right.
like, hey, like you do what makes you happy, and like this choice is yours. And it gets that kind of feeling of like, ah, I'm gonna always let somebody down
Yeah.
off your back. So
Right.
yeah,
Absolutely. Well, mostly off your back, right? And that's
that's
if they're diving into the individual coverage health reimbursement arrangement options,
that's
correct?
correct. That's
Yeah,
correct. Yeah.
absolutely. So, I was doing some digging on your background here, and you've spent 15 years working in global development and foreign policy, working towards ending global poverty. Thank you for that.
Thank you.
How
That's
do you
very
think that helps connect you you know, to the benefits world and the workplace, the HR workplace?
okay. Well, let's be honest. Health insurance is just another foreign country.
Yeah,
Like, and once you approach it like that, you're like, oh, this is its own special language and cadence and incentive structure. That then all of a sudden it's like, oh, okay, I get it. I get what's going on here. So, what I got to do, I got the privilege of doing in my early career, to answer your question more directly, is work in over 25 countries, see there, be the professional outsider of, okay, if we just look for these leverage points for change, this is how we make, community, create jobs, we make the community healthier, and got to work with health systems all over the country, all over the world, and apply those lessons learned of like, what can we learn and take through to our own backyard? And that's really, I see this as like a homecoming of like, okay, this is the I keep saying, I want people to be healthier and wealthier. That was
right.
true then, it's true now. And so that's what I want for every employee and every business that we partner with, that we're able to save the company on their bottom line, but like without compromising care. And then also where we're making a dent in that medical debt statistic that and the affordability crisis that this
Right.
country faces. So this is a new way to pay for healthcare. And it just draws on some of those lessons learned, that uh, I saw overseas, in different contexts, and it just opens your eyes, I think, and gives you a different perspective of what you're looking at.
Yeah, absolutely. Well, thank you for doing that and for bringing that, worldwide view. Because when you just said, I want people to be healthier and wealthier, I went in my mind, well, sometimes if they're healthier, they're already wealthier, right? Because you're not spending so much time away from work, unable to work because of an illness or, a temporary or long-term disability or some kind of condition. And then you mentioned the debt as well. And so it's unfortunate this all goes together in one of the most profitable countries in the world, but hopefully we'll get there someday. um, Switching gears one more time, AI. Let's talk about AI for a moment here. So in your current role, you say that you apply AI to help match employees with relevant health plans and benefits. That's interesting. How is
Mhm.
AI changing the game here?
Oh, it's it's so dynamic. So my co-founder, is also my brother. Uh, he was on the team that built Bing, the search engine.
Okay,
And that guy's
very
like,
cool.
I know, he's like walking AI. So, but also one of the things he's very passionate about. So, one something that's really common on benefit surveys is people are like, "Oh, how many times do you go to the doctor per year?" And then they do a prediction based off of the employee's input. Nobody knows. I mean, or there's like kind of a very narrow set of people who know that. Like, but you don't really want to think about, if you're a parent, you don't want to think about your kid going to the ER.
Right.
But big data of consumer behavior, it shows that like if you got a kid under 5, there's a good likelihood you're going to the ER. I'm sorry to say that. And
Mhm.
we don't, and then because of those kind of emotional biases, we're just really bad at predicting the future, but data is, and that's where AI can help. And so we do a prediction from payroll data of this is what could happen to you, this is what it costs, and then that's how we filter the plans we show you. So instead of 100, we show you 2 to 3. And then depending on what other information you're comfortable giving us, we can do other projections. So like there's so much data in healthcare, and
Yeah.
we can do at a minimum where we started was doing a better job on prediction and helping the consumer really frame this as a financial management decision, and go from having like kind of emotional decision, to more of a data driven decision about
Yeah.
that.
Facts.
Yeah, exactly. I would add, since we started, we've seen the rise of tools like ChatGPT and Claude and Gemini, and we're also seeing that change consumer behavior too, because the consumer can like ask. People are asking ChatGPT, tell me about a deductible, tell me about this, and like verifying what we're recommending. And so what was maybe true of like you needed HR and a benefits broker to walk people through benefits. I think that's still true for the record, and but it's augmented now by the consumer Googling. It's actually no, it's like they're not just Googling, they're like looking at like they're talking like of like
Right. They're
the
having interactive conversations with an AI
exactly.
system and hoping that the information on that AI system is factual, which yeah, a lot of it is. I teach ChatGPT how to use ChatGPT for HR, and so there's a lot of great information in there, but you still need a professional say, "Hey, is this right?"
Yeah.
I on this platform or a training advantage. I just did an updated chat GPT training and I said the same thing, like HR still needs to look at this information if it's an HR topic. If it's an accounting topic, accounting needs to look at it. So folks that are listening, if your employees are using AI or any tool to answer questions, you still need to pony up and get in front of them
You
and
do.
say, hey, we
You
need to
do.
correct what you think you know because that doesn't work with our plan or with our plan options.
100%. What we're putting out there too is you can create like custom GPTs, right? Like the
Yep.
on Chat GPT, for example, if you were to look up ICHRA Guru, we created a chatbot on that's publicly available
Ooh.
on ChatGPT where you can kind of monitor the answers a bit and like make sure it doesn't hallucinate. It's not perfect, don't get me wrong, but where you can control the how it's crawling the data. So and that's also where our software too, where we look at I think that's the difference between like a public tool versus maybe a tool that's been curated is that you can make sure it's right with greater accuracy. It's still not perfect, but
Yeah. So that's how you pronounce the acronym ICHRA,
yeah, ICRA.
the
Mhm.
Individual Coverage Health Reimbursement Arrangement. Whew. ICHRA.
Yeah,
I like the
it's a
shortened
mouthful.
version a lot better.
Yeah.
My final question for you is about, culture, engagement, and future of benefits, which I think we're kind of diving into. But looking ahead even further, 3 to 5 years, what do you believe is going to be the most significant in shift in employer provided health benefits?
Okay. So I think we have a reckoning with some because of the immense costs that
Yes.
healthcare is creating, that some people are even asking, should we even provide benefits?
Yeah.
And should this be like, is this model even serving us? Should we be at the end of employer sponsored benefits? I think that it will, because of that question, we're looking at the existential questions that are coming up, that you will see the rise of alternative models and that a decoupling of employee healthcare from employment, like where more personalization, like personalization demands that the employee direct more of the design and decision making. So I do think that those trends are coming. I do think if we fully uncouple employer sponsored healthcare, I don't think that will happen in full. That's my hot take. But if we do it, the thing I hope we keep as culturally, the root of that, why we provide benefits is this kind of this social contract between employer and employee
Right.
of I take care of you. This is part of my responsibility. And I hope we keep that culturally of like that it's the employer's job to create a supportive enabling environment for the employee to succeed, but maybe it looks different. Like it's not like, like there's
Yeah.
different boundaries and in it, but
Yeah, no, it's 100%. I mean, I could just say being, my career, the HR lady career, way back when, we did benefits more because we wanted to let our employees know that we cared about them. But now it's kind of like a mandate. If you don't do it, you're not going to get employees and you're certainly not going to keep employees. So one thing there is for folks that are listening is if it ever does come where it keeps decoupling more and more and more, you're going to have an exodus if you're not an amazing culture with great leaders and managers and engagement. So keep that in mind. And then I was looking up statistics again about from that survey. It says benefits are now seen as a primary lever of feeling cared for by the employer. 60% of employees say benefits make them feel more cared for and loyal, and 59% say benefits boost their engagement. So it all goes together. And if
Mhm.
it ever does start, it sounds like it is going to start decoupling a little bit. But if it ever goes to the mass exodus that say, yep, you can get it wherever you want it, because that's what I think we thought was going to happen with the Affordable Care Act. Note, if you actually make any type of money, it's not affordable whatsoever. And so that name itself is kind of a little bit of a joke. But if we ever do get to where employees are like, yeah, I can just go anywhere and get health care for a decent price, they might be looking at leaving organizations and going to organizations that really care about them and are really engaged. What are your thoughts on that?
I think it separates out. Honestly, I think there's like a chicken and egg here. The benefit strategy and total reward strategy tells you a lot about the employer. And there's a correlation, like the more comprehensive the total rewards, you tend to have an employer who's like very, very focused on employee engagement, wellness. They kind of go together. The ones that
Yeah.
are like doing this for like let meet the legal compliance minimum, you kind of see how they interact with their employees in other ways. They go together. So I that's where I don't think it goes away fully, but you're right. Like if you start to strip it away,
Yeah.
you gotta like up level in other levels.
Yeah,
Or
you got it. You should be anyways, because it's
yeah,
so expensive to recruit and retain these days. So you should be doing it anyways. But this is your 2026 kickoff of the year message to say now is the time to get your leadership and your engagement and your culture where it needs to be. And then also considering, looking at other benefits alternatives. Fair enough?
yeah, absolutely. 100%.
Awesome. Well, thank you so much. This has been so helpful. I have some homework to do myself now after this. How can people connect with you, Stacy?
Well, you can follow me on LinkedIn. I'm on also I'm just there, Stacy Edgar. That's probably the easiest way to find me. I'm also on Twitter as well, or I guess
Okay.
it's X now. So yeah.
Okay, sounds great. I will have Stacy's LinkedIn profile in the podcast notes. So connect with her there, get more information. Thank you so much for coming. And everybody, thanks for tuning in. I hope this podcast session has been beneficial and helpful to you. Talk to you soon.
Welcome to the HR Empowerment Podcast, where we will uncover strategies and new insights from HR professionals who discuss up-to-date regulations, best practices, and the most pressing topics like diversity and equity, leadership, dealing with difficult situations, and much more that affect your bottom line and business. Thanks for joining us.